Back problems can be anything from a dull ache or a slight twinge to devastating and debilitating pain. And for many people, especially women, they just live with the pain, never finding a solution. Joining me now is Dr. Scot from the Ohio Neck and Back Pain Relief Centers, and he's also the author of a new book, Good Back, Bad Back, 10 Things You Should Know. Dr. Gray, thanks for being here.
Thank you. It's great to be here, Gail.
What about your practice, and why did you decide to go into helping folks with their back pain as a chiropractor?
Well, I always wanted to be a doctor. Honestly, first of all, I thought chiropractic was a little strange, maybe a little quackery involved. And, I understand when my patients come in and feel a little skeptical because I felt that way one time.
Well, you even went into it.
Yeah, and I went into it. And the way that happened was my life changed one day when I was driving down to school and I got in a car accident and didn't know what to do. My mom sent me to her chiropractor, Dr. Glenn Izor here in Columbus, and that changed my life forever. I don't want to bore you with the rest of the details, but that's how I got started in chiropractic.
So you started in personal experience yourself.
Yes, exactly.
Then why did you morph into becoming an author? Why did you think it was important to write a book for folks?
It was really out of frustration in my office, because as a chiropractor, we can definitely help people to get out of pain, but I want to help people to get rid of that pain and keep it away, okay? And there's things that you need to know to do that. So what I've put in this book is all the things that you can do to prevent problems in the future.
But you wrote it specifically for women. But guys have back pain too, so why did you write it for women?
Well, I've actually had more experience working with women because in a chiropractic office, typically we see more women. Maybe it's because they care more about their health.
Or they'll at least go see someone if they have issues.
And they'll go see someone.
Not ignore them, which many men do. You're right.
Exactly right. So I put this together for women, and what I found is that if you look at the women of yesterday, they had to be amazing, but today women really have to be super women. I mean, they've got 4 jobs. They've got their 9-to-5 job. They're taking care of the kids. They're taking care of the other kids. Some people call those boyfriends or husbands. And I can say that. I'm coming up on my 1-year anniversary here, and I know my wife does a lot for me.
Well, we're busy people.
Very, very busy. And, it's not a matter of if you're going to get stress. It's a matter of when women will get, the neck pain, the back pain, and the headaches from all the things that they do.
So it's just inevitable as we age that something's going to happen.
Yes.
So in the book, you describe ways for people to prevent, not necessarily take care of pain if they already have it, but ways to guard against it. What tips can you offer our viewers of what they should be doing every day?
Well, there's some simple things that you can do, just some simple stretches and exercises that you can do in the morning. It only takes about 10 to 15 minutes. I've outlined those specifically in the book, but it's just simple core maneuvers and things like that. And I always tell people that big doors swing on little hinges, and you do little things every day to prevent big problems.
What are some misconceptions about back pain and how people deal with it?
Yeah, that's a great question. First of all, people think that, when they get back pain, it'll probably just go away on its own, and, we can just ignore it after that. What happens is a lot of times it doesn't go away. If it lasts more than 2 weeks, you definitely want to get it checked out. And also, if it just comes and goes, that means that something's going on in there, and you want to find out what that is. And another one is that, I guess those are really the biggest two that people deal with.
But I think everybody kind of gets out of bed in the morning, especially as they get older, and they're a little stiff, not just their back, but everything, their knees. So when do you really think or know that you have a real issue?
Well, when it lasts more than 1 or 2 weeks, then you know that you're dealing with something more serious. I had a patient that came in with some back pain, and he was an older gentleman, and he really didn't think that anything big was going on. We checked him and went through a couple maneuvers with him, worked with him for a little while. His pain was just not going away. I knew there was something else going on. We had him checked, and he had cancer in his spine.
Oh, my.
So, back pain can be signs of more serious problems, too, like cancer and kidney problems. So you really need to get those things checked out and not ignore them.
How often can chiropractic treatment take care of back pain? Or in some cases, you do all you can and surgery is a must?
Yeah, and surgery is necessary in about basically less than 1% of the cases of back pain. That's what the research shows. So there's a lot of cases of back pain, though. 85 out of 100 people will get back pain. So 85% of our population will have low back pain at some point in their life. So but less than 1% of those are surgical cases.
Okay, well, I know you want to offer a free book to some of our viewers. How can they get this for free?
At my website, goodbackbadback.com, they can download the book for free. So if you go there right now, for the viewers of Daytime Columbus, they can get this book at no charge. And you can get it on Amazon, but you have to pay for it there, so go get it for free.
And there's lots of good advice in here. I was skipping through it. There really is. Dr. Gray, it's a pleasure to have you here. Thanks much.
Thanks, Gail.